Question, which one matters more? Because some people are like, oh, my systolic's good, my diastolic's bad, or vice versa. Can you pick which one's worse, or both have problems?
Yeah, they're both important.
Okay,
Go ahead.
Not
When you're
one.
measuring your pressure, do you have any sort of tips for people who are trying to monitor their blood pressure? Just go to the doctor and have the doctor measure it, or anything they can do?
Yeah, so that's a great question. We love it when patients take their blood pressure at home. Because about 25 to 30% of patients that come to my office today will find that their blood pressure might be elevated, but when they go home, and if they actually do home readings, the values are probably normal. And we probably all heard about white coat hypertension, and we don't want to treat somebody who has an office reading that's elevated, but it's absolutely normal at home.
I want to show you how to actually do the blood pressure. This is on the electronic machine. A lot of times when you go in the hospital to triage, you'll see that. And it tells you exactly how to line it up based on the artery. So you take the patient's arm and you wrap it around. Notice you have to make sure it lines up to where that artery is. So you wrap it over, make sure it's snug enough, squeeze all the air out of it. Then simply just hit start button. Once you hit the start button, and then it's going to start taking the pressure. During this time, you want to tell the patient to remain still and perfectly calm. Try not to move around too much because you don't want any misreadings. All right, so now we just took the blood pressure, and if you take a look, their blood pressure is 130/85 with the heart rate of 105. All right, so for this one, basically this is the one that you see in the hospital as well, your blood pressure cuff. It tells you exactly where the artery should go. Make sure you have your measuring tool in the correct place. You can take it on either the left side or the right side. For convenience, we're gonna take it on the right side, but you typically take it on the left side because it's closer to the heart. So we have the patient lift their arm up. Again, you wanna make sure you line everything up like it's supposed to be. Have them rotate the arm over. Now for here, you want to get as tight as possible, but not too tight. Be uncomfortable. Again, notice that it's lined up like it should be. Go ahead and place my stethoscope on. I'll place my stethoscope in between what we call the AC joint, or the AC and the cubicle. We're going to place it right there, and we're going to go ahead and take a pressure. While I'm pumping this, I typically pump to about 160 to 180 and then slowly release. The first bump that I hear, or thump that I hear, is the first pressure, it's your top number. And then from there, I let it go again till it becomes very faint. Once it becomes very faint, that's gonna be a diastolic. So with this one said, the first thump, the first loud thump was around 131, 132, and the most faint one was around 81. So about 132/80 is her blood pressure.
Attention please. Please keep silent and relax. Keep the cuff at heart level. Thank you. Your blood pressure is systolic pressure 117 millimeter of mercury pillar. Diastolic pressure 87 millimeter of mercury pillar. Your pulse is 98 beats per minute. Measuring result is normal. Thank you. Wish you a good health.
Here's how to keep your pressure down. Aim to eat 5 serves of vegetables and 2 serves of fruit each day. Be active for at least 30 minutes every day. Ride, walk, or try an activity you like. Quit smoking. Limit your alcohol intake. Reduce salty foods. Always check the food label and choose products with the least sodium.